Hi, we're back and we're going to take a closer look at revenue management. And again, here's the cycle of a claim. So we submit a claim electronically, the claim is processed. Right. And from the processing, it goes to adjudication, making sure that we review it, make sure the codes are correct, everything that we have is needed on the claim, and then the medical office or facility gets paid. I always think of HIPAA standards as relating to data security, data privacy, but what covers these medical offices and how they exchange medical information with PHI is if they're covered entities or not. We always think of them as physician offices and hospitals, but they also include such things as healthcare clearinghouses, managed care plans, TRICARE, workman's comp, commercial plans like MODA, Blue Cross Anthem, Indian Health Services, the VA, and other examples of covered entities. Globally, if any provider, meaning a medical office, submits or receives transactions electronically, in all likelihood, they are a covered entity. Of course, insurance companies aren't going to pay claims without appropriate documentation. So this would include such things as all the supporting documents, the claims, the remarks, all these different types of things. How can we avoid resubmitting claims? First thing to do to avoid resubmitting claims is to make sure that they get paid on time. With several states, if you delay submitting claims for Medicaid services, it's very simple. The office just doesn't get paid. So very important to stay on top of the coding, billing, revenue cycle steps to ensure that claims get submitted on time. The other item to think about is the coordination of benefits, right? So who is going to be the primary payer, secondary payer, and so on. Your book gets into some examples of that using the examples of divorced children. That is just one of several examples that can cause uncoordination of benefits to result in claims being delayed. After this claim is submitted, the claims need to be sorted to collect and verify data about both the patient and the provider. This typically involves third-party clearinghouses, payers, and other things to scan and process these claims. The scanning technology uses OCR software to read the information on a paper claim and converts it to an image that can be analyzed, edited, and validated. Claims examiners look at health insurance contractual and CMS 1500 claims data on split computer screens to begin the adjudication process. On the right-hand side, you can see the process on the flow chart. The medical practice generates the 1500 claim in an electronic form. The specialist batches the claim and submits it to the clearinghouse. The clearinghouse puts it in an appropriate electronic file format, and then it verifies the claims data and transmits to the payers, being the insurance company. Here's an example of the split screen, the insurance identification number, the blue and the red, the 1500 form, and so on. So what exactly is claims adjudication? Basically, claims adjudication involves comparing the claim to the payer edits and the patient health plan benefits to see what is actually going to get paid. The other part of that is we need to make sure that all the required information is available to process a claim. Many times, claims may inadvertently be duplicated, right? Or different payer rules and procedures aren't followed. Right? Something's a non-covered benefit, that means that the claim will be rejected. And then let's take a look at this flow chart here. The clearinghouse submits the claim to the payer, and the payer performs claims validation. And it could be one of three paths, excuse me. The claim could be approved for payment. Medical office gets paid. The payer denies the claim until more information is provided by the medical office, right? Then the payer generates remittance advice and sends the provider office to get more information. Then the last one is the payer can reject the claim, right? So if it's rejected, assuming these are just missing fields and what have you, errors and omissions, the office can resubmit the claim. And just kind of a recap of what we took, the remittance advice, reconciliation, and payment of claims. After the claim is adjudicated, we can either approve it for payment and get it paid, right? So with that, just the term remittance comes into play. So in other words, this comes with the check for the provider using electronic format, explains the benefits, right? People are familiar with the explanation of benefits to the policyholder and the patient. And again, there are different timeframes and other variables that vary from state to state about how promptly a medical office is or is not paid. Insurance claims and attachments you need to be kept for at least 6 years unless the state law stipulates a longer time period. The source documents include all financial records provided by the medical office that they use to submit electronic claims. And the types of claims, these could be open claims, closed claims, remittance advice, unassigned claims, or denied claims. All of these items should be kept at minimum 6 years. Medical offices track unpaid claims, and basically they make electronic copies of each submitted claim. They log the information. They keep close tabs on the reasons that claims are denied, whether it's because the service isn't covered, right? If it's not covered, you're not going to resubmit it because you're not going to get paid anyway. Claims that are denied due to errors like missing fields is a very common one. Those get completed and we resubmit the claim. And then we calculate denied claims rates to improve clean claim submission. In an ideal world, what we want to do is to get all this claim data accurately coded and billed and submitted so we keep our accounts receivable down and get revenue coming in much more readily. Again, why are claims denied? Many times these are administratively denied. In other words, we didn't completely fill out the form. If you don't completely fill out the encounter form, you're not going to get paid. We could also have clinical denial. In other words, the services that were given were not medically necessary. So that's an example of a clinical denial. This slide here gives you just some of the reasons that claims may be denied. Very important one, the procedure or service is not medically necessary, pre-existing condition not covered for any claim that started prior to 2010, March 23rd. Could be a non-covered benefit. See a lot of these with plastic surgery and other different types of specialty services, termination of coverage, failure to obtain pre-authorization, out-of-network provider was used. All these other things could cause a claim to be denied. And again, when we talk about in medical record auditing is the next on the bottom bullet point about bundled services and global period services. In other words, people are trying to bill for something as a separate service when it's really included in the surgical service. We can also appeal denied claims. This slide kind of gives an overview on it. There's third-party payer peer reviews. There's peer-to-peer reviews. In other words, this service really was medically necessary. And again, there's a process. First level, typically with the MAC, the Medicare Administrative Contractor, then the QIC, the Office of Medicare Hearings and Appeals. And then the last step, of course, is judicial review in a federal district court. So a health insurance claim is denied by a payer because the medical necessity of the services was not supported by the reported ICD-10-CM diagnosis code. Is this an administrative denial or a clinical denial? Let's wait a minute and we will find out. Yeah, it's a clinical denial. You are correct. Right. The medical necessity was not supported by the codes, then again, it is in fact a clinical denial. And that's all I have for you. Please review the text carefully and make sure that you're clear on what these terms are. That includes claim adjudication, appeals, Medicare, administrative contractor, and so on. I'm available during office hours from 3 to 4:15 if you have any questions. Thank you so much. We'll see you online. Bye now.